Around the world, disaster can strike at any time, and often on an unanticipated scale. Populations are often displaced and become more prone to sickness, just as the health services they need are knocked out of commission or overstretched. Save the Children has committed to save lives and reduce suffering in these crises, where without urgent medical care, children can die from the most preventable causes. Save the Children's Emergency Health Unit was set up in 2015 to provide a fast and effective response to these situations.
So I called upon the Emergency Health Unit, a new medical response capability that Save the Children has, and they very quickly put together specialists who deployed at short notice.
The team have been deployed around the world, leading or supporting our teams on the ground to deal with disease outbreaks, accidents and full-scale disasters. They are on hand to provide health expertise or disaster planning, whatever the situation.
An emergency team can be deployed within 72 hours from the declaration of an emergency. And together with the emergency team, there is also the deployment of medical emergency kits in order to speed up the beginning of the response.
The EHU is made up of deployable teams trained together to provide global coverage. They have access to medical supplies and equipment with existing funding. They are made up of doctors, nurses and water and sanitation specialists, as well as logistics experts to get them and their equipment right to the centre of the emergency. The EHU have so far helped reach around 770,000 people in 9 countries.
We've been deployed in DRC. In 5 days, we succeeded to achieve 89% of our target.
I'm here with the Emergency Health Unit, which has provided mobile health clinics in this region for the past week. So far we've reached more than 1,200 people.
Save the Children provided support from staff, which is the most important thing, but also lots and lots of resources.
EHU teams initiate a rapid health response while creating space for the wider response to become established or scale up. They always aim to hand over to other Save the Children health professionals or local partners, ensuring that children continue to receive the quality care they need and locking in the progress they've made.
The Emergency Health Unit for me is not just about an immediate surge response. It's about how can it build on the existing country programme, but clearly be governed by the country programme during its deployment and making a real difference, not just for now but also in the future.
The Emergency Health Unit is striving to meet Save the Children's global commitments to increase the impact of our frontline emergency health response. Together with our staff on country teams around the world, we can achieve even more.